Coming to you live from downtown Toronto, here she is, Marilyn Denis.
Being here today. Thank you very much. Well, you can sit down. I want you to relax. We're going to tackle a big thing today. We've been battling the bulge since the beginning of time, but how we lose weight has been up for debate for decades. Watch this. There is no downsizing when it comes to the multi-billion-dollar weight loss industry. In the 1970s, we were introduced to diet pills. In the 1980s, we saw a rise in surgeries such as liposuction, which came with a painful and long recovery time. Since the 1990s, weight loss surgeries have been moving toward more non-invasive procedures with fewer side effects and shorter recovery time. Today, we're showing you the latest weight loss treatments promising to help you lose weight fast. All right, please welcome Dr. Melissa Hershberg. This is a great... I think everyone's going to be talking about this conversation today. The latest non-surgical weight loss procedures. That's what we're going to talk about right now. And the first one is what?
The first one is endoscopic gastric reduction.
Oh.
So it sounds really confusing.
Okay.
Basically what that is, it's a non-surgical alternative to the gastric bypass. So what we're doing here is shrinking the size of the stomach so that we feel full faster.
All right, and who's the ideal candidate for this?
So this is for somebody who's significantly overweight. So this is if you're what we consider in medicine morbidly obese. So if you have a BMI above 40, BMI stands for body mass index, and the way to calculate it is to take your weight in kilograms divided by your height in meters squared. So this is for if you want to lose weight for aesthetic purposes, but also if you have medical complications like diabetes or heart disease, and your doctor's telling you really need to
take
lose
the
weight
weight
off.
No matter how much
Exactly.
you've tried, you've not been able to do it.
And you haven't been successful, so
Okay.
Exactly.
But not just anyone can do it.
No.
No.
No. So this is done by very highly trained surgeons, and you have to qualify for this procedure. So if you go in and you just have 20 pounds to lose, this isn't for you. This is if if you're significantly overweight.
Okay, the next one, new procedure for getting rid of your tummy, love handles, or back fat. Wow, they got something to do all that? What is it called?
So the next procedure that we're going to be talking about is the liposonics. treatment.
Liposonics, okay.
Yes. So what this is, it's a laser machine, and it delivers high-intensity frequency ultrasound to target the subcutaneous fat level.
Now, what does
layer.
subcutaneous mean?
It means under the skin. So a lot of people worry that, oh my God, is this going to be dangerous? Is this going to, burn my skin? Is this going to harm my blood vessels, my lymphatics, my nerves? It won't. So this specifically delivers the heat to the fat layer, and it therefore destroys it, and then your body naturally eliminates it over the next 2 to 3 months.
Okay, so when you do this, I'm going to talk about who the ideal candidate is, but when it's the heat, it just breaks it apart a little bit, and then it breaks it down through your system?
Exactly. It destroys the fat cell, and then your body takes it through the liver, and over the next 8 to 12 weeks, you naturally eliminate it. So you're not going to see results instantaneously.
Yeah.
It's going to take about 2 to
months.
3 months before you actually notice the reduction.
Now know that you still have to eat properly and exercise.
Yes,
okay?
that helps for sure.
You just roll in, drive through, and go, okay, hit me.
Right.
You don't do that.
No.
The ideal candidate for that is?
So this is someone who's at their target weight. So, you already look great, but you can't seem to lose that last stubborn inch off your waistline. So you've done everything. You're going to the gym. You're doing your crunches. You're eating well. You're at your target BMI, but you still can pinch that inch. This is who that's for.
So it just works by you just sitting there, laying down.
You lay down, and then the doctor will go and mark the areas, and then they'll use the transducer, and that's how it works. So it's an hour procedure.
An hour procedure, okay. But you have to go a couple times a week.
Actually, so you go once. No, you just go once for this.
Really?
It's the rule of one. So 1 hour for losing 1 inch and 1 pant size.
Wow.
Yes.
Well, sign me up for that. I like one. Okay, the next one is cool sculpting. I've heard about this, not quite sure what it is all about.
Okay, so cool sculpting is really cool. No pun intended.
No, it's
Just
really
needed to say,
cool.
yeah. It's really, so what it is, it's the same in that it's for someone who's already at their target, weight, and they just need to lose that last bit off their waistline or their love handles. So what it does is it delivers freezing technology. So it selectively crystallizes and freezes the fat cells to destroy them. And then your body naturally eliminates them, thrusts it through the liver. And again, it takes about 8 to 12 weeks for you to notice the result.
But is that, again, a one visit thing?
It is.
Really?
Yeah.
Because it used to be in some of these procedures, that we've talked about, you have to go a couple times a week, and then you'd see the results in like 3 months,
Yeah, some of them you go several times. It just depends on how they work. And some of them you go once, and then you're able to, and you can go more than once, but one time should work.
And the ideal candidate for that one is?
Same as liposonic, someone who's at their target weight already, who just can't seem to lose that last stubborn bit off their waistline or their love handles, men or women.
Okay, and the results look like what?
Again, I would say it's about an inch you could expect off your waistline. There you go, exactly. So just a better contouring. So you're not going to lose huge amounts of weight. You've already had to do, the hard work.
Doctor's appointment. That's great. Now, in all of these, I go, do any of these hurt?
You know what? From what I hear, it's a pinching sensation.
Yeah.
It can feel hot. It can feel like a pinching. It can feel like a deep tissue massage, but it's not painful.
Okay, all right. And then we're not even going to talk about cost, because costs vary depending on where you go.
It does.
Okay, so you have to look that up yourself. Anyway, revolutionary new procedure about that loose, baggy skin under your chin. You know that? We're going to talk about that. What's it called?
So this, we're going to be talking about the relift procedure by reaction.
All right, we're going to see how it works. We're going to walk over there in a minute?
Sure.
Okay, tell me about this, how it works out.
Okay, so this is really cool. This is brand new to Canada, and it's brand new technology, and then it uses 4 different modes of radio frequency, a vacuum suction, and heat to target the different tissue layers. So what this is going to do, unlike the others, is it's going to target the skin level to give a lift and a tightening. It's going to stimulate collagen and elastin, and it's also going to go lower and shrink the fat cells. So it's not going to destroy them. It's just going to shrink them. So you can see more immediate results.
Okay. And does it last for a long period of time? Is it forever, or you just have to?
So the other ones destroy the fat cells. When you destroy the fat cells, you're not going to get them to come back. If you gain weight, it will come in other areas.
Okay.
This is more like when you lose weight through diet. It's going to shrink the fat cells. So if you then go and are not working out at the gym and you're eating a lot, it will come back.
Yep, we all know that. We all know that. So let's go see how this one works. We're not going to see the results right away, but certainly we want to see what it looks like. And we have somebody in our audience. Her name is Gail. Thank you for doing this, Gail.
My pleasure.
Okay, take a look at what's going on here. So walk me through this, Melissa.
Okay, so what we're doing here is using the transducer to target the area under her chin. So what happens as we age is we lose fat in our face. And when we lose the fat, what ends up happening is the skin sags and we get this collection. We get this jowls under here. So what we're doing here is we're tightening and we're lifting. So we're going to get a nice contour. And then you're also penetrating deeper, to work on reducing the fat that accumulates there. So here we're using it just for this area, but this can also be used on the abdomen. It can be used on different areas. And what this is awesome for is, let's say you've done the hard work and you've lost a lot of weight, or you've been pregnant and now you're back to your goal weight, but you have that sagging skin.
Yes.
This can really help tighten that up, and the results can be amazing. So it's almost like a non-surgical tummy tuck, and it can also help with the stretch marks. So this is a really new, innovative technology.
Wow. And so how many visits before you see the results?
So this would be more. So you can see instantaneous results with this, but they recommend that you do come back more than once. So you will come back maybe 6 to 8 times.
Sure. Yeah, and again, prices may vary depending on what clinic that you go to.
Right.
Okay, here's the before and after of what it looks like after, it depends on how many visits you actually need, but there is a significant difference right there. Significant.
Yeah, it looks
That's
amazing.
pretty amazing.
And how does it feel?
Very comfortable. It feels like a deep tissue massage.
I can't hear you, but that's what she's... Can we hear you? Okay, there you go. Go ahead.
It's very comfortable. It feels like a deep tissue massage. It's very pleasant.
Very pleasant. Do you want to stay there for the remainder of the show?
Absolutely. She can head to toe.
You could be here for 6 visits.
I know. She has a lot of work to do.
Well, up next... No, she does not. Up next, Dr. Melissa reveals the top 3 weight loss secrets that you should be doing right now. So we'll take a break. We'll be right back. Thank you.